Emergency situations involving tracheostomy tubes. The purpose of this video is to ensure that patients with tracheostomy tubes are appropriately managed, both clinically and procedurally, when the need to replace a tube occurs. This tube change may occur on a routine scheduled date or in the event of emergent dislocation or decannulation. To limit potentially detrimental outcomes, the following guidelines have been issued. Routine tracheostomy tube changes are performed monthly with a physician order, unless otherwise ordered. A physician must perform the first tracheostomy tube change after the initial tracheotomy surgical procedure. All patients with a tracheostomy tube in place will have a spare tube of the same size and type by the bedside. A tracheostomy tube one size smaller than the patient's current tube should be available within the center for use in an emergency. 2 licensed clinicians are present for all routine tracheostomy tube changes and, if possible, for unplanned tracheostomy tube reinsertions. Equipment needed. Suction setup in working order with 2 sterile suction kits. 1 tracheostomy tube. If using a cuff tube, ensure that the cuff is in good working order and is deflated prior to insertion. Water-based lubricant. Tracheostomy care kit. Gloves, both clean and sterile. 10 cc syringe. Pulse oximeter. Manual resuscitator or ambu bag. Plastic waste bag. Oxygen mask and source, if applicable. Sterile 4x4s. If the tracheostomy tube comes out or there is difficulty inserting a new tracheostomy tube, do not express concern. That may alarm the patient. Position patient with the chin pointing toward the ceiling and the neck extended. If the tube is partially in the stoma, you can try and gently reinsert the old tracheostomy tube following the curve of the tube. If you cannot insert the old tube, proceed to the next step. If the patient normally requires oxygen and/or is on a ventilator, place oxygen over the tracheal stoma site using an ambu bag and mask or tracheostomy mask. Gather the equipment needed for the tracheostomy tube change. An assistant can do this while the other caregiver administers oxygen, encourages adequate breathing, and/or provides manual resuscitation. This includes a tracheostomy tube identical to the patient's current tube and one a size smaller. Cleanse hands and don gloves. Place the obturator in the new tracheostomy tube and lubricate the tube with water-based lubricant. Gently insert the new tracheostomy tube and quickly remove the obturator. If unable to insert the new tracheostomy tube, prepare a tracheostomy tube one size smaller than the patient's current tube. If patient has a patent upper airway, have assistant occlude stoma with sterile 4x4 and monitor patient with pulse oximeter. Apply supplemental oxygen as necessary or, if ventilator dependent, bag the patient with a manual resuscitator at 100%. Immediately contact the physician. Both clinicians will stay with the patient and call for help from the room. When additional clinical help arrives, one more attempt to reinsert the smaller tracheostomy tube will be completed. If unsuccessful, 911 will be called and the patient will be transported to the closest emergency. If successful, reinsert the appropriate inner cannula. Secure the tracheostomy ties. Assess the patient's vital signs: heart rate, respiratory rate, breath sounds, and pulse ox. Document in the medical record.